Getting high. That's probably one of the top 3 reasons why people go to the psych ward, and it's probably not number 3. Is this the fault of the patients or a psych system that attracts patients that are prone to drug usage? I'm gonna let you be the judge, but I'm gonna give you some stories from my experience and offer my 2 cents to make $1, because this might surprise you. Now, why might a patient come to a psych ward just to get high? Because they know they can. And how do they know that they can? Because they're around a bunch of other patients who have prescribed medications, painkillers, benzos, opiates, the whole gambit. And during med time, patients often line up like cattle, not that they have any other choice, and they're given their prescribed medications. Now, when they're in the psych ward, sometimes psychiatrists take that as a time to try to wean a patient off of addictive medications, which typically doesn't go well. We're in a constant loop of not solving the problem. You give patients addictive pain medications for real pain that they're having, then when they become addicted to that medication, you blame them for being med seeking and try to wean them off, but it doesn't solve their pain or their problem. But they have no problem with quickly diagnosing a patient with a disorder that they don't have, weaponizing it against them and taking them to court to have them in the psych ward for X amount of days so that the psychiatrist and hospital can bill the insurance company and rake in the profits. In my opinion, psychiatrists in America, a lot of them are certified drug dealers. And sometimes they even get cracked down upon by the DEA like the psychiatrist I worked under did. Multiple times, mind you.
We are living in a psych ward. I'm quite sure this is psych ward. I'm quite sure.
Welcome to Jay's Psych Ward Stories. I share my experiences working in psych for 7 years. I've seen a lot. And after sharing my stories on TikTok and they started to go mega viral, I realized that we have something here. A lot of people can relate to these stories, but they don't have a platform where their voices can be heard or their experiences can be validated. In comes me. So if you enjoy this type of content and you want to see more videos like this, definitely be sure to like this video, definitely subscribe, share this out with somebody that you know would love this type of content, and help us grow so that we can make more videos and do more cool things, because TikTok is cool and we're going to keep that going, but we don't know how long that's going to last, so we need it to last over here. So without further ado, let's get into the video. So how might a patient come to the psych ward and expect to get high? So I mentioned how other patients can be prescribed a plethora of medications. During med pass, when they all line up and it's time for you to get your meds, there's morning meds, there's afternoon meds, and then there's night meds. I've seen this countless times working in psych for 7 years. Patients, they talk to each other. They might ask what you're in here for. They might see that you have painkillers. They're talking about their issues, traumas, things that happen to them in life, and meds do come up. And during that time is an opportunity to exchange value, if you know what I mean. Now, while they're in line, some patients made a deal that, hey, I like that medication for you, so what I will do is cheek my meds. What that means is when the nurse gives you the medication, you take the med, you fake swallow, and if you're really good, then you can hide it under your tongue, so when they say open, they don't see nothing, you got it tucked under, or they don't care to look or to be that in depth about their inspection. You cheek that medication, head straight to your room, spit that out in the sink, put it in a little paper towel, and give it to the other patient. There's patients that work out deals to cheek medications just so that they can get a higher dose and a higher high from their own meds. So let's say they got a painkiller that they take. They might cheek that medication, cheek and cheek and cheek and cheek. After all of those pills stack up, boom, they take them all at once and they get in a heavy dosage. Sometimes they even keep them and then redistribute them outside of the psych ward. Or they give it to another patient in exchange medication. Oh, you got that opiate? I would love that. You want this Norco? YouTube don't flag me. TikTok don't flag me. I'm giving these people education and entertainment at the same time. Edutainment. It's true. These are things that actually happen. When you know you can go to a place that has a centralized focus of pharmaceuticals being pushed, then you know all you need to do is go to the emergency room and say, I'm depressed, I'm anxious, I'm suicidal, and I have a plan. Legally, their hands are tied, and we wonder why beds are so full in the psych ward. How many people are there that actually need help? Now, granted, if they're there for drugs, they need help too. Just not the type of help that they're going to get for themselves, because they have become masterful at manipulation. Man, I'm telling you, when I first started working in the ward, people would be telling me all types of problems that they have. And then I realized that there are zombies in their room getting higher than a kite. And I'm like, oh, I had to learn to read between the lines and recognize. And I'm not always right, but I learned a little something or two, and I'm trying to teach y'all. The idea of most people would be be to say, oh my gosh, those med-seeking patients, those addicts that are taking the spaces of people that actually need the help. Okay, be that as it may, just because we got psychiatrists in suits, don't mean that they're not the problem in and of themselves. Yo, I seen a woman that was addicted to a certain medication and wanted a higher dose from the doctor. Literally have her meeting with him, the psychiatrist, sit on his lap, stroke his beard and say, did you get a haircut? And he's sitting there giggling in front of me and the nurse. Now this is my first year in psych, so I'm like, is this normal? Does this happen? And she got her increase of meds that night. I'm not gonna lie to y'all, there are great people working in a lot of psych wards. People that will talk to you, people that will help people with their real issues, meet them where they're at, empathy, understanding, patience, etc. We need those types of people. At the same time, it also allows cologne to be sprayed over the feces of the services that other patients are getting, especially the ones that are more vulnerable. Now, if you're going into a psych ward and you're lucid, you're able to control your thoughts yourself, you're just having a hard time in life, you're typically not going to get messed with like that. What you can, if you watch my last story about a woman who went in and she was suicidal and then she went through the whole gambit and they were going to keep her for weeks. She was just struggling with everyday traumas. Her boyfriend had broke up with her. She was afraid she'd lose her job. And there were other mental stressors financially and stuff that was getting her at the time. That could lead you to the psych ward. Most of the time, those people are going to be fine. They're going to get in, get out. If they have any complaints, in hindsight, it won't be that big of a deal, but sometimes it can be. I'm talking about the people that are so far gone in their disorders, whether they're schizophrenic and they have auditory and visual hallucinations that don't allow them to be able to function on a regular day-to-day basis. Those people can be taken advantage of a lot. Sometimes their focuses are literally on things such as meds and then whatever their disorder tells them to focus on. Those are the people that are being taken advantage of the most. It's a revolving door of people that are homeless, addicts, or so mentally unwell that they are a combination of homeless and an addict. Our veterans go under that as well. And when I look at their plight and what they're up against and how I don't even have the mental fortitude to break down the corruption of the system, what chance do they have in their own eyes? So what are they gonna do? They're gonna get high. And the danger in that is that they're cheeking their medication, they're exchanging meds with other patients, causing the potential for things to go awry with their current treatment plan and their concoction of medications, because they're only thinking about getting high. They're not thinking about how this medication does not agree with this medication. And perhaps if the mental health system was actually about serving patients with integrity and with dignity, we'd be able to catch these issues and they'd be less and less and less. But because it is profit first and making sure that bottom line is taken care of, everything under that bottom line that patients and the system is able to get away with will and still go under the radar. But let me know what you think about this in the comment section. Do you think drugs are an issue? Are you surprised to hear that getting high is among, in my opinion, the top 3 reasons why a patient might end up in the psych ward? Let me know your thoughts, your experiences, if you know anything about this, or if you were in the psych ward getting your meds, whether you do it now, whether you used to do it back in the day. Hey, we here for all the tea, we listen and we don't judge. Thank y'all so much for watching, and I'll catch y'all in the next video.